It was a year defined by strikes, marches, queues and backlogs, which left many feeling it's the entire healthcare system itself which is on life support. The compounding effects for Max at this surgery in Fleetwood, Lancashire, getting injections to ease the pain in his knees which need replacing, a waiting list measured not in months but years.
Do you mind me asking how long you've been waiting for that?
At least a couple of years, isn't it, Doctor? Yeah.
And then the next one?
Well, since this one's been bad, this one's started to go worse, yeah. But this isn't down for a replacement as yet.
He'd have to have another referral for that, and then he'd be at the back of the line, along with the 13% of the UK population that are on waiting lists at the moment.
This is a story echoed across the nation in varying forms.
Hey, blood pressure first.
And today, a poll regarded as the gold standard in the public's view of the health service in Britain has recorded the lowest level in satisfaction since records began. From patients in Lancashire to doctors in London, it all has an impact.
Figures like today, record numbers of record lows of satisfaction. How do you feel about it?
Yeah, it's actually really miserable. I've got to say, I love being a GP, and my patients know that when they see me. But it does make you feel really disheartened that, despite working harder and longer every day and doing more complex work, that actually our patients still aren't getting the service that they want and need.
The issues, say the government, are circumstance.
Well, we all know that the NHS has had, to deal with the pandemic, and we all know that has created huge backlogs and huge waiting lists, and we're all committed to catch up, to provide a faster, simpler, fairer NHS. We're investing £165 billion a year. Obviously, if you're investing that much, you want to have people satisfied with the service they're getting. But we do know that we've been tackling, think for the last 4 months, the waiting lists have started to come down, but we're tackling a huge backlog.
The government say that in many areas the health service in Conservative-run England is faring better than SNP-run Scotland or Labour-run Wales. Public opinion, it would appear, disagrees.
There's no getting around it. The headlines here, the figures involved, make for uncomfortable viewing if you are the government. The lowest levels of satisfaction with the NHS since records began, down 5 percentage points in just 1 year. But pick apart the details, and it actually starts to look even worse for the government. The previous record low was 1997, when Labour swept a victory, promising to, quote, save the NHS. The record high was 2010, when Labour left power. This graph is political dynamite for Labour. Expect them to repeat it again and again across your social media platforms. But this mood seems to transcend party politics. 24% of Labour voters say they're satisfied with the NHS. Only 29% of Conservatives say they are. So the all-important question as we march towards a general election, just how much is the state of the NHS swirling around people's minds when they walk into their voting station?
People always vote on those big issues, and the NHS is one of the biggest issues. So clearly the general election, the NHS will be up there. We have to explain to people, although it's difficult, people have gradually stopped listening, but nonetheless we also have to have a vision for the next 5 years.
With an election looming, it's not just satisfaction with the NHS, but the government itself on the ballot paper.